plants, the manufacturing units, and those people, bring them all on a single platform, to to have what you say, to sense of to develop a sense, self respect and devotion for scientific approach about Ayurveda in total. And our national executive members, committee members of Vishwa Ayurveda Parishad are, we all know, respected Dr. Govind Sahai Shukla ji is president of Vishwa Ayurveda Parishad, Dr. Mahesh Vyas ji is general secretary, Dr. Yogendra Sharma is organizing secretary, Dr. KK Divedi ji and Dr. Surendra Chaudhary ji is both are the organizing team members, and the convener is Dr. Anil Shukla. So they are taking care of all the activities of Vishwa Ayurveda Parishad. Recently, around 7 months back, Vishwa Ayurveda Parishad, the organizing team, they have decided to further extend the activity of Vishwa Ayurveda Parishad, and they have formed various prakostha subject-wise, like this, our own Shalya Tantra Sambhasha. So likewise, there are 14 to 15 different prakostha, along with the Vidyarthi prakostha, Videsh prakostha, teachers forum and all. So with this noble aim to re-establish Ayurveda in a scientific way, Vishwa Ayurveda Parishad is taking a lot of effort. And with Vishwa Ayurveda Parishad Sambhasa, we are organizing monthly guest lectures of various eminent speakers from the field of Shalya Tantra. And we are fortunate, sir. I welcome today's chief guest, my guru, Dr. Rajeshwar Reddy ji, who was, former director of Ayush Maharashtra State, and he was also former dean of R.A. Poddar Medical College, HOD professor of Shalya Tantra in esteemed R.A. Poddar Government Medical College. So I welcome Reddy sir as a chief guest, and I am thankful to you that you have, with your busy schedule, you have accepted our invitation to grace the occasion. I am also thankful to our today's guest speaker, another legendary from the field of Ayurveda Shalya Tantra, and my brotherly friend, Dr. Bhaskar Rao sir, who is a retired professor and vice principal of SV Ayurveda College, Tirupati. So I welcome both of you. I pay my sincere regards to all the office bearers of Vishwa Ayurveda Parishad, the national executive body, as well as our own Shalya Sambhasa Prakosta, all the coordinators and all the participants who are here for today's guest lecture. So with this, I hand over the session to Amit sir. Amit sir, you can continue.
Thank you, sir, for a brief introduction about Shalya Prakoshta, Vishwa Ayurveda Parishad Shalya Sambhasha Prakoshta. Thank you. Now I like to request Pradnya Kapse madam to introduce our chief guest, Dr. Rajeshwar Reddy sir.
Hello.
Hello.
Anyway, I'll continue because we are already short
Hello.
of time. Madam.
Hello.
Yes,
Madam,
sir. Please.
Yes, sir. Yeah. Good evening to all. And this is my privilege to introduce our today's chief guest, and who is my guru, who is my mentor, who is my guide, and whatever I am today is only because of his blessings. So I really I'm thankful, and I welcome you, sir, Dr. Respected Dr. K. Rajeshwar Reddy, sir. Sir is, as Dr. Amar Dwivedi sir told, that he was a former director of Ayush of Maharashtra State, and he was dean of R.A. Medical College, professor and HOD of Shalya Tantra in Poddar Ayurveda Medical College. Sir is his highest qualification of Masters of Surgery in Shalya Tantra, and he is having his duration of clinical experience of 35 years, more than that. And he was a PhD guide. He's also guiding PhD students right now also. He was postgraduate guide, undergraduate teacher since last 35 years. He was Senate member of Maharashtra University of Health Sciences Nashik, which is a very proud moment for all of us Buddharites. He was a scientific advisory board member of Medical Research Council of DMER, principal investigator in ICMR multicentric specialization trials under the GTP scheme of Government of India. He was appointed as co-opted member of Institutional Board of Studies for PG courses, member of Ayurveda PG board, member of EXPG board, member of inspection committee for various Ayurvedic colleges as well. And as all of us, we know that the time will not permit if I will read his biodata, because it is more than 15 pages. So it is so huge, but it is very proud for me to say that sir has been awarded with various precious awards. He has been invited for multiple international and national seminars and conferences as a guest expert speaker, training coordinator, organizing secretary for various workshops. He was a chief coordinator for 1 month certificate Char Sutra course, which was being held at Poddar Ayurved Medical College. He was national faculty also in proctology in SCRC Con, and he's having his area of research, especially in leech application and in anorectal area of Shalya Tantra. So with this, I am very much thankful to you, sir, and welcome you on this platform as a chief guest for VAP-Sambhasha. Thank you.
Reddy sir, as you might
Thank
be
you, madam.
knowing, today's topic of lecture is on basically need of standardization of Anu-Shalya karma. So you may please guide with your word of wisdom, sir. Dr. Reddy sir. Dr. Reddy sir.
I think, sir.
Hello. Pradnya ma'am.
Sir is there, but his phone is. I'll just call
Mute.
him. Just.
Yes, sir.
Madam, can you contact the sir and please tell about that technical, please. Sir,
Reddy sir.
I have called him, sir.
Now
But
he has joined.
the call, he is not receiving.
Dr. Reddy sir.
please unmute other people. Please mute your microphones. Sir, Amar sir, can you introduce meanwhile up to our chief guest?
Yes, yes.
So,
chief guest already introduced. Now I will
but
be
just formal,
introducing our.
just our formal introduction, because where I started the lecture means afterward Reddy sir will join and.
Reddy sir. Dr. Rajeshwar Reddy sir.
In the last, sir will join us.
Dr. Rajeshwar Reddy, sir, I think some network issue may be there.
Yeah.
Hello. I think we can start with the program, and once sir joins, we
Yes,
will
sir.
request him. So now I introduce today's guest speaker, Dr. Bhaskar Rao, sir, who is a retired professor and vice principal of SV Ayurveda College, Tirupati. Qualification wise, sir is BMS MD Shalya Tantra, and sir has done PhD from Jaipur. Sir has more than 25 research papers published in international peer-reviewed journals. Sir has been invited as a speaker, as a resource person in various international and national conferences and workshops. Sir is author of around 8 to 9 books, out of which Arsha, a monograph on hemorrhoid, is one of the great write-up of Rao sir. Then he has written a book on Agni Karma, Jalokavacharan, Shara Sutra, and presently he is working on a very great manual on integrated proctology. Very soon we'll receive this book also. So he is, one of the pioneer in standardizing, thinking about standardization in various Anu-Shalya karma. When I was pursuing my post-graduation, sir has, taken a workshop on ROTP programs at Podar, and there he has, discussed various Agni Karma procedures and Shara Sutra standardization, everything. So it is, we are very lucky or fortunate that today we are having a legend Shalya Tantri, Dr. Bhaskar Rao sir, who will be sharing his insights on need of standardization of Anu-Shalya Karma. So I request Bhaskar Rao sir to continue his presentation.
Thank you, sir. Good evening to all. I'll go for my screen sharing, sir. First of all,
sure.
Sir, sorry for interrupt. Request is there. Please, don't shut down your video and microphone also.
Yes,
so
this
is a meeting is recording. Sometimes there is some problem. So don't close your video and audio both.
No, sir, I don't touch. Okay. Now I'm going for screen sharing, share screen. I have to go for share. And in that, sir, are you able to see my first slide?
Yes, sir. Yes, sir.
Sir, today I am privileged to be with the Shalya Sambhasha organized by the Vishwa Ayurveda Parishad. And I am privileged having a chief guest, my best friend, Dr. Rajeshwar Reddy ji, and my one of the very good friend, indeed, Amar Dwivedi ji. More than 20-25 years, I know him personally for his dedication, for his hard work, and for his research works. I'm also thankful to all the audience and other dignitaries involved in this affair. And today's my topic, as it was assigned, need of standardization of Anu-Shalya karmas. I would like to focus especially emphatically on the Agni karma. And as you are aware, Susar Samhita is the authentic science and scope of surgery. Having 1 lakh stanzas, 186 chapters, and there was a description of more than 20 surgical instruments, sharp instruments, 101 yantras, and more than 650 major surgical operative procedures, plus 1500 minor operative procedures, and around 900 drugs, 15,000 drug combinations. This total glory of Susar Samhita goes, it never be called as a a simple textbook. It is a treatise, rather it can be called as the encyclopedia of Ayurvedic surgery. Today, talking on standardization of Anu-Shalya karmas. Anu-Shalya karmas, the total philosophy of Ayurvedic approach in the management of various diseases is with the Shastra karmas, without Anu-Shalya karmas. Shastra karmas using of surgical instruments, and without using of surgical instruments, Anu-Shalya karmas. There are Tvaksara, Spatika, Kacha, Kurvinda, Jeluka, Agni, Khagoji, Shefalika, Shaka, Agni. These are the procedures have been mentioned. Among them, the top priority and the lot of work in the last 2 or 3 decades, lot of work was done on Kshara Karma, Kshara Sutra, Agni Karma, leech application, and Sira Vedana. And today, being a Chikitsa Prakoshta of Dakshina Pranta, I have also a special responsibility in participating in the Shalya Sambhasha, and I'll go for my topic straight away. Standardization, with a special emphasis on a clinico-radiological study of Agni Karma. Now I am being a guru to the RAV after my retirement from the TTD SSU Ayurvedic College as a vice principal professor. Now I am a guru on Kshara Sutra. Yes, this is the slide signifies the source of light, the source of energy, the source of any energy on the universe is the sun. Well, coming to the topic, when it comes to the WHO has divided the total population, and we think that how the percentage of sick, the percent of healthy people, the percentage of sub-health people are, it's a really a very interesting one. WHO has considered only 10% of the people are healthy. 20% are sick. For your information, 70% of the people are sub-health. And this sub-health of the 70%, in fact, only 20% of the real sick. 70%, why sub-health? Because of varied psychosomatic, functional, non-functional, and various disorders will come under that. And this is where Ayurveda can gain a momentum and work a lot in treating this condition. Well, Agni Karma, as I told you, parasurgical Anu-Shalya karmas, Agni Karma, leech therapy, and Sira Vedana, Kshara Sutra, Kshara karmas have gained a lot of popularity. Hundreds of publications nationally and internationally were done. But a little work, doubtful work, and still international platform, there is a complexity in understanding the various philosophies involved with the Agni Karma. Agni Karma, basically it comes a parasurgical procedure where actual heat is transmitted into the tissues. As you know, there are Aushadha Chikitsa, medical management, Kshara Chikitsa, chemical cauterization, Shastra Chikitsa, surgical management. Sarva Shastranu Shastranam Kshara Shrestha. Ksharadhapi Agni Shrestha. Agni na punarudbhavati. See, this is the interesting aspect of Susru Samhita. The parasurgical aspect, the Anu-Shalya karmas, even if surgical entities gets a failure, even surgical aspects could not touch certain zones. In that zone, these Agni Karma impact, the effect of leech therapy, Kshara Karma, have successfully paved a way. And today, Agni Karma, because and Sarva Shastranu Shastranam Kshara Shrestha, Ksharadapi Agni Shrestha, Agni na punurudbhavati. What the drug will not cure, the knife will cure. What the knife will not cure, the cautery will take care. What the cautery will not cure must be considered incurable. This was not the Susruta's quotation, and Hippocratic quotation is, what the cautery will not cure must be considered as incurable. And amongst the Agni Karma's indications, there are various indications. Well, Agni Karma methods, to speak them, there are very simple procedures of Agni Karma. And on the tissue wise, Twak Dagda, and it is only, it gives a Samyak Dagda audible sound. Mams Dagda, there is a discoloration and local edema, and Sira Dagda, and if you observe them properly, there will be constriction, Sira Sankocha, and local edema will be there, and Snayu Dagda, Snayu constriction and ulceration. And Asti Dagda, you can see the dryness, redness, and immovable ulceration on the Samyak Asti Dagda. These, taking this criteria and Agni Karma methods ought to be followed. And for that purpose, as you are well aware, and you are being in the practice of Agni Karma, we, Twak Dagda purpose, we take Shalaka, Pipali, and also excreta of the goat, tooth of a cow, we take for the Twagdagda purpose. Mamsadagda, Jambavashta Shalaka is the best instrument. Siras Nayostadagda, honey and ghee, oils have been heated, and in the pichu form or the pouring form or a drop by drop form, depending upon the lesion, we use these instruments. And there are various shapes, like we use Bindu Padagni Karma, especially for the warts and Sandhigata disorders. We do Bindu Padagni Karma. And Valaya cauterization was there very much in the Andhra Pradesh, especially in the Rayalaseema, around the umbilicus, in preventing the Kamala disorders. Vileka is a linear cauterization, especially the newborn children in the South India. They put a small linear cauterization just above the umbilicus. This is actually, in fact, to revitalize the immune system. And there was also a pratisarana, irregular cauterization, where the lesions, chronic and like Grandhi, cystic lesions, after the removal, irregular cauterization will be performed. There are other mentionings like swastika for apasmara, ashtapada, multiple wards, sandhigatavata, and ardhachandrakara shape, semi-lunar Agni Karmas. This is very much described by the Susruta in the inguinal region, and we have done a lot of work. I'll come for this. Well, and types of Agni Karma, Plushta, Durdagda, Samyak Dagda, and Atidagda. And we know, and for any therapeutic cauterization of the Agni Karma, we take the Samyak Dagda only. Remaining things like Plushta, Durdagda, Atidagda are to be avoided. But knowing this, how to do, where to do, this is very important. And for newcomers, new practitioners, especially for the PGs and house surgeons, the total protocol may be divided into pre-operative phase, operative phase, and post-operative phase. Pre-operative phase, keep ready your patient, keep ready the instruments and aseptic precautions. And operative phase, actual transmission of heat. That is as per the shape, size, number, that depends upon the disease pattern. Post-operatively, any soaking of Jatya, the Estipodithaila, or any churnas which will be sprinkled on the lesion to avoid the further damage of the tissues. There is a mentioning of, even in the Western criteria, it is called as fiery. Say there were a lot of discussion. That's what, when I visited European countries, and especially America, Australia, there is a lot of, some areas, some states even banned this procedure, considering as a brutal procedures. But after knowing the therapeutic impact, even one by one state, even the European states, have started accepting the greatness of the therapeutic cauterization. Yes, there are various synonyms. Arab people call it as a makha or K. Chinese people call it as a moksa basjan. And Indian, we, Susra Samhita, considered this as a dahana karma. Greek people considered as a misam. Misam is also a synonymous the Agni karma. And the moksa basjan, this is a very interesting Chinese aspect. It is almost like a Agni karma, but on the acupunctural point, a cigar-like thing will be filled with the chrysanthemum family's powder, and which will be heated like a cigar, and the heat will be exposed to the acupunctural lesions. So, and that way they do practice on the low backache areas, knee joint disorders, and especially and wrist joint disorders, tennis elbow. Successful practice has been documented by the Chinese system. Well, and very interesting debate, which metal is the best metal, whether it is a copper, whether it is a iron, whether it is a silver, whether it is a saptadhatu shalaka, whether it is a, as we know from our texts, the best method from Susur Samhita is the gold. Gold is the best method. Even the European culture, the Muslim cult also accept gold as a best methods. Coming to the aspects of Agni Karma, see, as from the Panchamahabhutas, Agni has a all chemical changes are accompanied by the absorption and the release of heat. This intimate connection of matter and energy, all the Panchabhautika relation is very much with the Agni. This was there more than thousands of years. And my dear friends, in the practice of Agni Karma, you can safely practice the Agni Karma procedures like ankylosing spondylitis, low backache, carpal tunnel syndrome, even constipation. Certain points are there for the Agni Karma with the Moksha or the Agni Karma, Dupuytren contraction, fibromyalgia, hemorrhoids. Agni Karma is one of the procedures. I'll show you some of the pics. And sprains, strains, and rheumatoid arthritis, rotator cuff syndrome, sciatica, tendinitis, and TMJ. And there are various indications for Agni Karma. And it is the only thing is you have to be careful. You have to be judicious in selecting the things in executing the Agni Karma procedure. Yes. What Agni? It is a transfer of heat. When you refer the thermodynamics, the heat is transferred to one area to the another area. What is it a heat? Is it a energy? Is it a transfer of something else which is quantifiable or not? And this thermodynamical aspects, when we think, a lot of information we get from this. Energy can be transferred by heat from objective to another objective. And this heat is actually quantified through the measurable quantity in terms of electrons. You can quantify the heat in terms of electrons and the time which you execute into the field. And we were discussing, there is a lot of discussion was going on. And even I could not say since a decade back then, which metal is the best metal? Copper. I'll tell you, if you take the atomic structure of copper, you see there are total number of electrons in the copper are 29. I'll show you a picture of this. And the atomic structure of, if you take the gold, the total electrons in the gold atomic structure are 79. And when it is a silver, there are total electrons are 47. If you see the structure of this, gold have multiple orbits, and the outer orbit contains one electron. When it is a copper, number of these things are less comparatively, the quantum jumps, and outer electron is the one. And when you see the silver has also one electron. And iron, when you see, the outer electrons are 2 and the number of gems are less. When there are more number of gems with a single electron seeing the gold, it is always easy. More number of gems with single electron in the outer orbits less, more orbits, single electron, and with the usage of gold, the transmission of heat, that is in terms of electrons, could be very easy with the metal of gold. Vice versa with the copper having one electron, silver also one electron with the less number of orbits. Whereas iron only less number of orbits, but 2 outer electrons cannot transmit the heat or electrons judiciously into the tissues. That is the reason why iron has become a Adama Loha and gold has become a Uttama Loha, seeing the structural electronic atomic configuration, we can document scientifically why copper, silver are the best instruments, and definitely gold is probably the best, and Adama is the iron. This is how source of heat can be transmitted to the other tissues. And this is very interesting for the, especially in the practice of Agni Karma. The transfer of electrons from a potential energy to the lower energy is very important. And this also depends, and the transmission levels will be varied from the tissue to the tissue. Kinetic molecules of hot metals, the transmission, the absorption rate could be definitely different from Rasadhatu, Raktadhatu, Tvagdhatu, Mamsa, Asti, Majja. There are variations in transmitting these kinetic molecules. And the energy, we think it is a kinetic energy, potential energy, chemical energy, thermal energy, and random molecular motions and different heat capacities have been described. Now we directly talk with the thermal energy. You can in future, you can work a lot with the potential kinetic energies, chemical energies, and other chemical reactions, heat capacity generating sources. You identify them, you transmit, and you can vice versa. You can how best they will work on the various tissues has to be studied in depth. What is human body? Human body, for your information, is a physical manifestation of a collection of chemical elements, mobile electrons, and electromagnetic fields. My dear friends, the total body is made up of a chemical elements, mobile electrons, and electromagnetic fields. And whenever you attempt with the Agni Karma, definitely there are changes in the extracellular fluid and intracellular components with the presence of electromagnetic zone, and change of mobile electrons could have a possibility in altering the pathology. This is where you have to work in establishing the real values and real philosophy of Agni Karma. Well, my dear friends, transmission of heat will be different from muscle tissue, will be different from nerve tissue, will be different from epithelial and connective tissue, bone tissue, and also it is different from cardiovascular systems, digestive system, endocrinal system, skeletal system, and system-wise also transmission of heat could be different. And these assessments, in depth of studies in future, will give you a way for establishing the real philosophy of Agni Karma. And the Chinese system is also very interesting. When you see, refer them, the meridian points, yin and yang points, and these yin and yang negative zones, and they have also accepted certain sensitive zones, meridian points on the body, which are similar to our Marma Pradeshas, almost similar to the Marma Pradeshas, working on the Marma Pradeshas, taking the help of the Chinese system of medicine. In sometimes it will be useful work in further. Dear friends, human body, as I was telling, it is a nervous system with impulses traveling at up to 248 mph, the muscular system, contracting and relaxation of some of the body's 600 muscles, and endocrinal systems involving hormones produced by glands, and alterations and repercussions with Agni Karma will have a significant change on this human computer, provided if you execute properly with the Agni Karma. Is one of the fascinating work you can see. And my dear friends, in the practice of Agni Karma, I tell you, once you put the shalaka on the lesion, wherever it is indicated in the practice, we think that it will absorb the heat and it will disappear. The heat absorption prevail on the tissues for more than 2 to 3 hours. This was a uniquely photographed and can deeply penetrate more than 2 to 3 inches. A special study was done on this. I'll show you. These are the some of the works. Yes, these are the circulatory changes, my dear friends. Before healing the heat, just before the spot, before Agni Karma, after 30 minutes of the Agni Karma, you can see the total lesion has been spreaded up to the 1.5 inch of the depth. My dear friends, the same photograph has been conducted after 60 minutes. The heat levels have been intensified with the integumentary system of the body has been intensified. This was a photograph was taken after 60 minutes with a special unique camera. This can be documented positively. And the role of Agni Karma, how it will have impact system-wise, can be documented further. Well, and the mechanism of Agni Karma to speak, as we know, Agni Karma, which does the Dhatu Utkleshana and does the Ama Pachana, makes Dosha Niramata, and Vata and Kapha could be brought back to the normalcy, is one of the simple way how we enumerate the mode of action. And there are a lot of the things, theories of mechanism. There are from European cult, first theory and second theory, the two intense inflammations in the same system could have lessen or remove a chronic inflammation. And skin over the treated with the Agni Karma will become a permanent fibrosed bandage which will protect the lesion. Well, it is how a direct heat transmission into the tissues does the Dhatu Utkleshana, improves the Dhatu Agni, causes Ama Pachana, making Niramata. Niramata of Vata and Kapha could be easily brought back to the Dosha Dusya. Samurchana Vigatana is a simple logic and philosophy is involved. Apart from that, European science, a article which I could able to collect, the Agni Karma which is transmitted into the tissues can stimulate the piezoelectricity which is present in the bones, releases certain electro signals. These signals will resist the deformity in the tissues, further prevent the damage, is the secret of Agni Karma. My dear PG friends, my dear practitioners in the Agni Karma, taking these supports, and we can establish the facts of Agni Karma. Along with that, it has a local and systemic effect. Local effects, we know it. Systemically, it has effect on the lymphatic circulation, neurohormonal circulation, circulatory impact. My dear friends, a simple Agni Karma can enhance, increase the lymphatic circulation to the 6 times, releases an enzyme which is called 30 times richer in histaminase, which is called as diamine oxide, which is very, very useful in the joint inflammations, joint disorders of varied disorders. And neurohormonally, serotonin levels and melatonin levels have been improved, and also circulatory system, antibody antigen phenomena, and improvement of the albumin glucose levels will have a local resistance immunity aspects which will be definitely helpful. This is one of my publication. Yes, what it does, how actually brings more defenses to production of more antibodies, and momentarily constricts the body vessels, blood vessels, temporarily accelerates the blood flow, exudation of plasma induced as a result, increased osmotic pressure, and accumulated catabolic products will be eliminated. There will be maintenance of tissue acidosis and changes in the colloidal crystalloidal structure with the Agni Karma is one of the beautiful philosophy involved with this Agni Karma aspects. My dear friends, which releases the noxious substances from the Sroto Avaroda, development of hyperemia provides a fibrotic ring, and that will actually in fact protect the joint, and which has a more production of anti-collagen antibodies, which will prevent further damage of the joint, has been observed. European publications, you see. My dear friends, there are, as the topic was given, Amar Dviji, suddenly it was so sudden, because these Anu-Shalya karmas, especially the Agni karmas, the alternatives are like injection of acid, injection of lugols, brachytherapy, cold beam lasers, cryotherapy, moxabustion, direct energy transfers, and its stimulation of the meridian points with heat, increasing of the heat by various substances can be future scope of study for us. And it is also suggested for us, we have to further work on what histopathologically it is taking up. And with the help of electronic microscopic assessment and biochemistry assessment has to be done on this, and chromatography, electrophoresis will establish the determination of the collagen synthesis and even plasma electrolytic changes, cortisol changes, glucagon changes, because with the available facilities, with the help of Agni Karma, taking these parameters when you work, depending upon the case, you can definitely prove the interesting work you can evolve. And also you have a scope to work on Shat Chakras and Agni Karma. What is the role? What is the impact of various Shat Chakras? And the wavelengths on various systems can be done. Yes, these are the, for your information, these are the instruments, ancient instruments, 3,000 years back, I could able to collect from the Australian library, how they were practicing with these instruments, ancient Agni Karma instruments. This was a little modification, modern Agni Karma instruments. The source of the fire, you can see heating. This is heating the shalakas and placing hot metal, different neck regions. And Agni Karma sites have been, this is the 11th century photograph I could able to collect for the jaundice. If you can practice at the little finger and base of the thumb. And these are the marma points, they have a significant role in stimulating the immunity aspect, is a still on date in the Rayalaseema, Andhra Pradesh. There is a traditional practitioners doing Agni Karma at this level of, these are the 11th century photograph. This is another 11th century photograph of Agni Karma for sciatica. You can see the points. This is how sciatica nerve passes through. These were the instruments. Agni Karma for partial disc prolapse, sciatica. In 30 years back, how we were doing with the primitive instruments. And we have taken up a project in the Department of Shalya, and we were treating various X-rays, CT scans, exactly what mechanism it is involved in the joint bony lesions. So will it reduce the joint space? Will it prevent the osteophytic changes? Will it have any significant change in the, we have done a lot of work on the radiological study, and you can see the before treatment and before treatment of a patient with the osteoarthritis. These are the before treatment, a group of studies we have taken, and you can see the lateral view. There is a patellofemoral fusion and total diminution of the joint space. Even one of the interesting work we have done on the Vata Kantaka or the calcaneal spur, you can see. And before and after, you can see a dramatic change. There is a improvement of the joint space. Diminution of the osteophytes was observed with a mere simple X-ray. This was a work done by 20 years. And you can also see the calcaneal spur changes with the simple X-ray. And now some of the CT scan film photos we have taken up with the help of CT scan. This was a work done on the osteoarthritis with suprapatellar bursitis, and taking the highly tended spots for Bindupada Agni Karma was performed. This was another interesting case doing Bindupada Agni Karmas. This was a recurrent corn, operated thrice, recurred back with simple Agni Karma procedure, and it was, there was a total lysis of corn and which never recurred back. This is another interesting case of osteoarthritis with you can see the suprapatellar and infrapatellar bursitis changes. This is a joint cell tumor of the tibia. We have a initial primitive work we have done. You can see the giant cell tumor on the proximal end of the tibia, but the pain, swelling, and really it has come out. See the changes of the tibial proximal changes of the giant cell tumor, where they could not do anything, and with Agni Karma for years together, the progression of the disease, the pain has come down, progression of the disease has been stopped. This is one of the interesting case of calcaneal spur. There are case. This is joint cell tumor of the tibia, film. Yes, one of the interesting work we have done in the department of Shalya Tantra, probably it was the primitive and a daring work in the department of Shalya Tantra in the irreducible. I mean, in the case of inguinal hernia, there is a chance of inguinal hernia. Vankshanayor sandhi madhyabhage ardhachandrakarani. This Agni Karma has to be done in the Vankshanayor sandhi madhyabhage. This is when you take the inguinal hernias, reducible, irreducible, complete and incomplete. My dear friends, be careful. Reducible and incomplete, especially bubonocele and funicular type of the hernias are very interesting, where if they cannot be posted for surgery or some other disabilities are there, disadvantages with the post of the surgery, contraindications. In such a condition, we have done a lot of work on good number of patients. The interesting, you may question me, doing Agni Karma in Vankshanayor Sandhi Madhyabhage, if you refer the anatomy, Vankshanayor Sandhi Madhyabhage is the mid-inguinal point. And once you do Ardhachandrakarani, more than 7 to 8 points, exactly identifying the mid-inguinal point where the protrusion of the viscus or part of the viscus will be come out into the ring, through this ring into the scrotum, which will come out. And incomplete hernias are selectively taken up the work. So here, it does the fibrosis of the transversalis fascia, which allows the contents of the abdomen into the scrotum or into the inguinal canal, have been observed for months together because of these fibrotic changes in the transversalis fascia, will prevent further protrusion. You can see the bubonocele condition. And this is another case of Kadara case, recurrent of giant cell tumor. This was various cases of osteoarthritis, pre and post. You can see the joint space improvement. Osteophytes, reduction of the number of osteophytes been observed, my dear friends. And this condition, if it goes to a dermatologist, they never treat. They give different antiviral drugs, and no antibiotic will work. And they try to remove it. Again, it will recur. It was operated more than 2 or 3 times with a single first sitting. Multiple warty growths have been dissolved with single application. And I will show you. This is another corn cases and filarial indications. You can practice safely with the help of Agni Karma. You can see this is a very interesting case of, my dear friends, PG students. This is a case of epidermolysis bullosa, which was left by the modern dermatologists and surgeons because of its recurrence rate. And we have done with the Agni Karma. Epidermolysis bullosa is a genetical problem which will recur very frequently. With the Agni Karma, we could able to solve the problem permanently. Types of Agni Karma in the Sandhigata Vata. These are various cases. Agni Karma in the Vata Kantaka. Instant relief in the Vata Kantakas. Instant relief, I can say proudly. Bindus and Rudrasi, along with the course of the sciatica nerve, multiple, more than 5 to 6 Bindupada will be suffice. This is Bindupada Agni Karma in Rudrasi. You can see at the tip of the little finger also. Video which is not working. and Agnikarma in inguinal region. You can see the semi-lunar Agnikarma, probably daring work in the Department of Shalyatantra, where I was a professor. We could do that successfully. You can see the healing of the track. Yeah, this is another interesting case of multiple wards on the Mons pubis case, where it was operated earlier by different surgery, laser, cryo, this and that, which was recurred back. We could do 1 or 2 applications of Agnikarma, which is able to dissolve with the wards of the Mons pubis. How we were doing this, simple Agnikarma procedures, they have fallen with 1 or 2 applications. Careful transmission of the heat is very important. You can see the photograph, which has almost dissolved. And arena of Agnikarma, sun is the source, and a lot of scope for the Agnikarmas. Thank you. And because it was already delayed, I don't want to delay again. Thank you. Thanks a lot. And especially Madhuvedi, my best friend, and Dr. Rajeshwar Reddy happened to be the chief guest of the today's program. I'm really privileged being a Chikicha Prakoshtak of the Dakshina Pranta. I am honored to speak on this. And thank you, one and all.
Thank you so much, sir. Your talk was, eye-opening for many of the PG scholars and those who are willing to work in the field of Agnikarma. Your lecture was full of scientific validated facts which you have collected from the abroad also. And definitely a few things were even new for me also, what you have incorporated in your presentation. I would just like to say that mostly, nowadays Agnikarma is promoted as a instant pain management tool sort of thing. I always believe, being an academician, then Agnikarma is not just a pain relieving tool, but it's a complete therapy, I would say. Because
Yes,
I have seen many diseases which can be reversed, or even the prognosis can be, the progression can be stopped with the help of Agnikarma. In Maharashtra, sir, we have 2 different type of Agnikarma we practice. One is the conventional method where we do the heat burn therapy, which we call as Samyak Dagdha Vrana Agnikarma. And the other is promoted by late Dr. Gokte, who was practicing in Pune. So what he used to do is he was giving indirect heat method, like he was using a salaka or a gold probe, keeping the tip of the probe at the desired site and giving the heat from the other end of the probe. So that was sort of indirect heat method, which I have written a paper on it, and I have modified the device with the help of electronic interference. And the second type I have named as Dagdha Vrana Rahita Agnikarma. Means there won't be a scar after the Agnikarma. So that is how we can think about various different modalities of Agnikarma, how we can perform. The
yes,
other
sir.
thing,
Yes, sir.
just a curiosity, as you have shown a case of inguinal hernia or bubonocele where we can practice Ardha Chandrakar Agnikarma. In the Dalhantika, we find a reference sort of, Viruddha Padangushta Pradesha Agnikarma. So we can have a club of both the things, and definitely I create an hypothesis. I put forth a hypothesis that this must be having action on, deep ring where there is a reflex mechanism of muscles
Yes,
from
sir. You
where
are right,
the
sir. Yeah.
where the inguinal canal and the protrusion starts.
Yes.
There also, we can pacify the action of muscles at the deep inguinal
Yes, sir.
ring. So
The
that
other
can
side
be
of the lower limb with the tip of the little finger, it has to be.
correct.
It has a
Correct.
neuromuscular reflex onto the lesion.
Yes.
Sir.
Yeah,
You are
yes. Yes.
absolutely right, sir.
Correct, sir. So, being an academician, we can definitely think of various aspects where how we can justify the mode of action. And overall, sir, your presentation was wonderful. We would definitely like to have your talk on other parasurgical procedures in future also.
Definitely,
And
sir.
this was definitely a wonderful thing. I am actually sorry for the technical glitch, as the reason Dr. Amit has already said. His institute is undergoing NCISM visitation, and that's why everything was delayed, and these things are.
Problem.
But
This
sir,
is our Vishwayurveda Parishad program,
yes,
and we are being a part of it. We never feel a delay or anything
yes,
because
yes, yes,
being
yes.
a
Correct,
Chikitsa
correct.
Prakostak of Dakshin Pranta, it's my privilege to be with you, and thank
Correct.
you, sir.
So with this, I thank all our national executive members of Vishwa Ayurved Parishad, to name Dr. Govind Shukla ji, who is the president of Vishwa Ayurved Parishad, Dr. Mahesh Vyas sir, who has
My
joined
pranam, sir,
in
Govind
the
Shukla ji.
Ah, yes, yes. And Dr. Mahesh Vyas was there in the initial phase. He is the General Secretary of Vishwa Ayurved Parishad. I am thankful to Yogendra Mishra ji, Dr. K.K. Dwivedi ji, who has been recently appointed as a NCISM member. Dr. Surendra Chaudhary ji, who is the convener and Sanyojak of Vishwa Ayurved Parishad, and my friend Dr. Anil Shukla ji, who is national convener for Vishwa Ayurved Parishad. So I am thankful to all our national executive body members who have given us this platform to, have such type of very noble interaction among the Shalya Tantra people. And same time, I am thankful to my Shalya Tantra Sambhasha team, uh, my coordinators. Dattatreya Rao sir is also our coordinator from South Zone.
Yes, sir.
Dr. 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 Yogesh Badve sir is there, who is looking after the North Zone. Dr. Amit Paliwal and Dr. Pradnya Kapse, who is the co-convener for Shalya Sambhasa Prakoshta, and Dr. Burman, Pankaj Burman from Assam. He is looking after the East Prakoshta of Shalya Sambhasa. So I'm thankful to all the coordinators and all the participants who have their time, their valuable time they have given to attend this session. And with this same line, once again, I thank you, Rao sir, for
Thank you, sir.
giving
It's my
wonderful
privilege
lecture.
always.
Yes, yes, and definitely we'll associate our link, is Balaji. We are always we are
Welcome, sir. You are
associated with
welcome.
them.
You're most
So
welcome.
next time, many times you felicitate the smooth darshan of Balaji. So I'm really thankful to you, and may Balaji bless us all. And with this, with the permission of Amit Paliwal sir, can you end this session with vote of thanks? Paliwal
Hello,
sir.
sir. Yes, sir.
We can conclude the session with Swasti Vachana.
Yes, sir. Yes, sir, please.
Om Swasti no Indro Vridha Swaha Swasti Naha Pusha Vishweda Swasti Nastarsho Arishtanam Swasti no Brihaspeda. Om Shanti Shanti Shanti. So thank you one and all, and good night.
Good night.
Thank you, sir.
Thank you, sir.
Thank you for giving this opportunity, and thank you for adjusting me today's late due to my some official work. Sorry for once again. I am very sorry to all of you. Thank you, sir. Thank you and good night, sir.
Good night, sir. Good night.